Good morning. Today is August 2nd, and I am Jim Cuccinata here to open morning coffee. Very excited because I think today you're going to have a very professional opening to the show. No offense to Mark Cook, but we're going to talk about something very exciting today. I have Andrea Davis with us. Dr. Davis is a physical therapist as well as an expert in training young athletes, but especially female athletes. So welcome, Andrea.
Hi, thank you. Thanks for having me.
Yeah, we're thrilled to have you today. So tell us a little about yourself.
Well, I'm a physical therapist by profession. I've been treating patients, orthopedic patients, since 1999, so about 17 years of experience in orthopedics. I have a special interest in women athletes.
Right.
I was fortunate enough to play sports my entire career, from when I was 8 years old up until up through college, actually. And then when I graduated college, I coached women's softball at Camden Catholic High School, and then I went on and coached at LaSalle University.
Great, so softball expert.
Yes, softball.
Very nice.
Yes.
One of the things that is interesting about Andrea, talking to her before the show, was that you're really passionate about understanding the differences between male and female athletes and getting that word out.
I am, having gone through it myself, training on various levels, from weekend warrior when I was a kid, rec leagues, through high level sports, and then through the recruiting process of playing college ball, and then watching, kind of experiencing it myself, but then watching as a coach what some other players have been put through, some of the young kids, not necessarily appropriately for their age.
Right.
So that became concerning to me as a therapist. I'm seeing kids coming in younger and younger with Tommy Johns and quad strains and things that really, 10, 11, 12, 13-year-olds really shouldn't be seeing.
Sure, like a lot of those repetitive motion type injuries that kids should be avoiding.
Correct. So what seems to happen is they start playing and they're good, they show some promise. People get really excited about it when they're 12.
Right.
And they want to start pushing when they're 12. So, let's do 15-pound dumbbell curls, and let's do, throw weighted balls from the outfield to home plate. And I don't know necessarily that all of those are appropriate for everyone.
Right.
Now, for some, that rare special case that you're going to find, 1 in 500 maybe, totally fine. But for the normal, 10, 11, 12-year-old, their muscles aren't developed enough to really be handling some of that stress.
I'm Jim Cuccinata. I'm here with Dr. Andrea Davis. We're talking about kind of the training of children, specifically with girls. I know that from my personal experience of training girls, we know that lots of exercises don't work for them.
Correct.
Could you tell us some of the guide drills that are kind of destructive for girls?
So the guide drills, the one that comes to mind immediately are bench press and push-ups. And I literally just had this conversation with a parent the other day who was kind of teasing his daughter that his 4-year-old son could do better push-ups than she could. Okay. And I casually commented, well, there's a basic structural difference between your son and your daughter, and that comes with the differences between the male chest and the female chest.
Right. So
inherently, girls don't do push-ups initially very well. They certainly can. I mean, I can. I'm not fantastic at it, but sure. I can. But when they're going through that development stage, right. 10, 11, 12, 13 years old, they're in that awkward kind of stage. They're growing into their bodies, and their chest, quite frankly, is starting to form a little bit, and that gets in the way of that muscle development.
Okay, interesting. And ACL, right? Huge issue with girls. Huge,
yes, of course. Hormonal changes, the latest research, at least from what I've seen, is telling us that the incident of ACL ruptures during sports is actually higher during the menstrual cycle. Okay. So that, kind of contributes to how we deal with training and trying to pass that along to our college athletes, our high school athletes, making sure that the training staff is aware of these things. And they are. The athletic trainers are the best ones to know that information and kind of filter that and figure out how to process and get that out to the teams.
Right. But you're talking at high school level,
Correct.
right? I mean,
yes.
at a rec level or a travel level, there are no trainers, right? You're relying on a coach or the person who comes in that is a trainer that really knows
Right.
nothing about what the athlete.
Right. So
should be doing.
this is one of the things that this kind of is one of my sticking points. Dr. Google or Googling some great drills or some great exercises for your weekend rec team or your travel team or even the elite travel teams is fine. But you're going to get what you're going to get, essentially, right? So my husband, who has nothing to do with the health profession at all or in the health field, he could look up some drills and stuff, read the information, and what he spits back to me would probably be totally different than what I would read, see the information, filter through, and then process and spit it back.
Right.
That's what I do. That's what I do for a living. It's what I've done since, for almost 20 years now.
Sure. And if a patient would come to you, or not a patient, but an athlete would come to you for the sports rehab and training, what kind of evaluation do you give them?
So it all starts from the evaluation. It's patient education. So whether it's a 12-year-old, 10-year-old, 25-year-old, it doesn't really matter. The approach matters because you try to adapt to your patient.
Right.
But it's patient education. So you do hands-on evaluation, check range of motion, check strength, check agilities, make sure everything's structurally sound. But then you want to educate on top of it. And I think that's a lot of times where our profession falls short, the physical therapy profession. We go through so much rigorous training. We have so much information. And 9 times out of 10, we're not really filtering that through in a patient-appropriate way.
You know how you can fix your patient education issues?
I do.
Yes, you could call Halo Health. We can help fix your patient education issues.
On it. Duly noted.
Nice. Building around the athlete and the ACL, especially with the girls, right? You're explaining to me really 3 muscle areas that you focus on for the girls, right? What kind
Okay,
of...
so when you talk about ACL, you're talking about the primary stabilizer in the knee, right? So if this fist is my thigh bone and this fist is my shin bone, the ACL is preventing it from shifting back and forth. Okay, so if the ACL does not exist anymore, your thigh muscle, your quadricep muscle, now becomes the primary stabilizer. So once you have surgery and have that repaired, the focus becomes 1 on range of motion, 2 on strength, and when you talk strength, like your original question, quad strength,
Right.
hamstring strength, and then core and hip stability, actually.
Excellent.
Because you want the abdominal muscles and the hip muscles to absorb the pressure and take it off the knee.
Great. I'm Jim Cucinato. I'm here with Dr. Andrea Davis of Davis Physical Therapy and Sports Rehab. Welcome to Morning Coffee. We will be back after these messages.
Sub some sizzle. This is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to speedraceway.com or just get here now.
When it's time for Jersey Mike's to make a really great sub, this is what we do. It's what we've been doing. It's what we've always done. It's what we'll always do. So what are you doing? Jersey Mike's. Be a sub above.
Today's show was brought to you by Alicia Kelly of White Horse RV Center in Williamstown, New Jersey. Alicia is your RV expert. Contact Alicia at whitehorserv.com or give her a call at 856-262-1717, extension 203. When you think of RV, think Alicia Kelly.
Today's show has been sponsored by Farmers Insurance in Voorhees, New Jersey. To protect your assets and the people you love, call Mike Skoranek, your local Farmers Insurance agent, at 856-336-2553.
We are farmers. Bum, ba-dum, bum, 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 bum.
Welcome back to Morning Coffee. I am Jim Cuccinata. I'm here today with Dr. Andrea Davis, and we're learning about physical therapy and sports rehab and training. In the first segment, we spoke about the sports rehab and training. Today, though, or this segment, we really want to talk about the PT side. I think that I speak for most people. We really don't know what you do. So why don't we start with basically, what does a physical therapist do?
Okay. Physical therapist is an expert in biomechanics and movement. How your body's put together normally, so normal movement patterns. So to be able to understand abnormal movement patterns, you really need to have a good handle on what normal looks like.
Right.
Like anything else, you need a solid baseline. So you come in with an issue, you know, it's usually pain driven. We base most of our planning off of function.
Okay.
So you could do something maybe 2 weeks ago, and now you can't do it.
Right.
So then you end up coming to see us.
Okay. Can I come see you directly?
You can, yes.
Okay.
In the state of New Jersey, actually, I think it's up to 49 states, you have what's called direct access, so the general public can come see us without seeing your family doctor first.
Okay, and that would be, I would assume, right, just from my little bit of knowledge, PTs are pretty accessible. So if I woke up and I said, hey, I have a back pain, and I called you guys, you may see me before my
Absolutely. So,
general practitioner.
And that's actually our normal pitch when we would meet with family physicians. Family physicians in general, if you think about it, they run the gamut, right? They're your primary care physician.
Right.
So they see you for the common cold, they see you for your yearly physical, your annual blood work, all of these things, and they can see you, yes, for sprains, strains, anything that's going on with you. But with that said, unless it's an emergent situation in which you're bleeding, and then they'll send you to the ER or urgent care these days, they're not going to probably get you in as quickly as we can, because that's all we do.
Right. And then you guys kind of would act like the point guard, right? Because you would then inform the general practice physician what's going on.
Correct. So say you come to you wake up today, my knee's been bugging me, I've had it, I can't run like I used to, I'm going to give you Andrea a call. You come on in, we do an evaluation, and the rules of our practice dictate, our state bylaws dictate that we must refer out if it is not a PT related, or we can't reasonably place a diagnosis, PT diagnosis on you, we must refer out. We can see you for up to 30 days, so we can see you for a month. That's usually the length of stay of physical therapy anyway, a couple times a week for 3 to 4 weeks. We can see up to a month. If things aren't resolving, then we must refer out, so we can't see it past that.
And typically, orthopedist is typically where you...
Orthopedist or family doctor, if it's something a little, iffy, if we think you may need an x-ray, and that's all we just want to make sure that everything is the way it's supposed to be, so we don't add insult to injury. We may just tell you check in with your family doc, see if, they'll send you for an x-ray. But orthopedists, yes, generally, if you're an orthopedic physical therapist and you've been around for a while, generally speaking, you have a good network of physicians. So you try to match the patient personality with the physician profile.
Okay, that makes sense.
Mm-hmm.
Do you accept insurance?
Yes,
Okay.
yes we do.
And from the initial jump?
Yep, right from the initial jump, we'll do a thorough evaluation. We offer free consults. Most places do, but free consults in the sense that, hey, why don't you come in? Let me tell you what I think's going on.
Right.
I'm going to tell you if I think I can help you. I'm going to lay out a plan for you, and then you make the decision there if you want to continue with therapy.
And obviously, plans are different for each person, and they're individualized. But what does a general plan look like? If I came in, let's say specifically I came in with a back issue.
Okay, you come in with a back issue. So back's always the tricky one, and that's usually, it's one of the most popular, but it is a tricky one. Backs are very complex and complicated, and they overlap a lot with things that are going on in either the hip or sometimes in the upper leg region. But back assessment requires very thorough examination. So we take you through range of motion. We take you through some McKenzie principles, which is a school of thought dealing with the spine. You know, and it's usually a 2-day process. So I'll evaluate you for sure day one, get a good grip of what's going on, send you home with something to do right there that day. My back evaluations, I'll call you that day to see what's going on, and then the next day I like to see you the next day.
Okay, see how you reacted to everything.
Exactly, because it's really easy to give you a back program, and it's really easy to not get any better with a back program.
Right.
So the therapist, myself, you really need to be engaged on what's going on, very specifically what the reactions are.
Right. And then one of the things that I know that you stress is that there's always homework.
Always.
Right. And that's kind of a key, right? Because you're with the physical therapist, say, twice a week, but you're with your body 7 days a week. So
right. So on the first visit, that's one of the things, that's what we spoke about earlier about patient education. Most people want to get better. They don't want to feel this way. And if you do it right, you should be able to stay away from me, as much as I want to see you, stay away from me if I do my job right and educate you in the proper things to do. So the meat of your treatment should be my expertise, but things that you can very easily do at home should not be going on in the office. You should be able to do that at home.
Right.
So it's a partnership, 50-50.
Yeah, absolutely. And then I guess one of the big trends, right, is the home care physical therapy. Is that something that's usually done in conjunction with going to a rehab facility or a physical therapy facility, or is that typically done in a vacuum?
I guess you could say it's a vacuum. So home care typically runs under a section of Medicare or Part A Medicare. 2 sections to Medicare. Part A is hospital-based and home care, and then Part B is outpatient rehab and physical therapy. So home care falls in that Part A category. And how I explain it to people is you go to the hospital for whatever reason, you come home and you're not quite yourself. What you went into. So our job as therapists in home care is to bridge the gap between coming home from the hospital and getting you to either outpatient or getting you to your family doctor, but to make sure you're safe in the home.
Okay, great. When we come back from this next commercial break, we're going to talk about all the services that Andrea offers, including concussion evaluation and fun things like that. And we will also wrap up so you can understand why you would need to go to a physical therapist and why specifically it should be Dr. Andrea Davis. We'll be back after these messages.
Today's show is sponsored by Hargrove Demolition, your demolition experts. Hargrove is a family-owned and operated business right here in the southern New Jersey area, bringing you 45 years of demolition expertise. Hargrove has all your demolition needs, from emergency demolition service to demolition equipment rental. Hargrove is one of the state-approved recycling facilities right here in the southern New Jersey area. No job is too big or too small for Hargrove Demolition. Contact them today at one of their 3 locations.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to speedraceway.com or just get here now.
When we make Beyond Natural dry dog and cat foods, We start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at purinabeyond.com.
Extra Innings is the nation's premier indoor baseball and softball training center, featuring indoor batting cages, 7 multi-use tunnels, and training rooms. Extra Innings can provide professional instruction, private and group lessons, and the best year-round clinics. Along with a nationally recognized pro shop that features the latest and widest selection of equipment and apparel, our experienced staff can provide you with the right instruction and help you find the best equipment for your ability and budget. Extra Innings, where the game never ends.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
Welcome back to Morning Coffee. I'm Jim Cuccinata, and I'm with Dr. Andrea Davis today of Davis Physical Therapy and Sports Rehab. We spoke earlier about the sports rehab, and we were getting into PT. But one of the things that I think people don't really know is all of the different services that a PT offers. So if you want to tell us about those.
Expand upon those?
Yeah, that'd be great.
Physical therapy comes in many forms. Orthopedics is usually the big one, you know, sprains, strains, fractures, post-op surgeries. There is specializations in pediatrics, vestibular, post-concussive care, neurology, and when you go back to school, when you go to finish your degree, or as we older PTs go back for our doctorates, you actually have to take classes in all the subspecialties. So there's, you know, wound care and basically anything you can think of, there's a PT subcategory for it.
Great. And you guys are very different, but you're kind of a kissing cousin to, say, occupational therapy, correct?
Yes and no. Schooling's different, and I don't know enough to comment on more intense, less intense, equal measure. But I know the occupational therapy profession is moving towards doctoral level studies at this point. It is a master's degree, so it's usually a 4-year undergrad and then a 3-year graduate program. So, but yes, they do more modifications, home modifications, cooking, toileting, bathroom, showering, things of that nature.
Right. So you kind of get the person kind of back together and on their feet, and the occupational therapist kind of helps them get through their daily life.
Correct. So a lot of post-stroke neurologists, neurology symptoms and issues, and then like in the older population, if they can't get out of the wheelchair, like how do you deal with that for you know, self-care?
Sure. So you guys are kind of good partners.
Yes.
Yes. So you know, all you occupational therapists out there that are looking for a good physical therapist, make sure you give Dr. Davis a call.
Please do.
One of the things that I found interesting, because I was, in truth be told, a patient of Dr. Davis's, was that you kind of work through the pain, right? One of the interesting things, is that you baby till you're healed, so to speak, and then you have to push through some of the pain to get the results that you need. How do you balance that?
So it's a skill. It really is a skill, and it's one that really only comes with experience. I mean, some are more gifted at it than others. So I think the key component, though, is communication between the therapist, like you and I. We had to talk about it. Okay, this is what I think is going on. This is what I think we should do. You know, what are your thoughts on that? And you know, end of the day, bottom line is patient always has the say. Can I try to get the result that I want through different interventions? Sure, and I think that's what comes with experience and skill. But you need to know what is okay pain, like we'll say discomfort.
Well,
and
it's hurt versus injured.
True, right? The age-old conversation. I heard injured. But then you kind of have to know what's okay and what's not okay. And what's not okay is, you know, pain that's lasting, and you have these conversations, you know, okay, so if it lasts for more than 24 hours, then we have an issue. We have a different issue. But if it only hurts when we do this, and then we come out of that, then I think we're okay and we move forward.
Now, have you adopted the new pain scale with the smiley faces and the sad faces?
Yeah. I mean, you kind of have to. Everybody rolls their eyes. You know, patients roll their eyes. You know, give us a number, and quite honestly, the number is more of an objective, quote unquote, objective measure, mostly for insurance companies, truth be told. But it does, and sometimes you know, patients don't realize. Oh my gosh, it's an 8. It's an 8. It's a 15. 15 out of 10. But yet, you know, they're standing up, walking around.
Sure.
What your pain level and what my pain level are probably two totally different things.
Different.
Right. Even if we're experiencing the same surgery or whatever. So that's why you really do need to individualize things.
Right. And then one of the big things I know you're a proponent on is making sure that you adopt some type of exercise routine when you're finished your physical therapy.
Absolutely. That is, we missed the boat on that. I think I've been in the field long enough now and worked with a number of clinicians, and a lot of times when we're done, we're done. I really don't believe that. I think when I'm done, you're just getting started, really.
Right.
So I've done my job if I can kind of springboard you into an exercise routine. And you did that extremely well.
Well, thank you.
Which was very exciting.
Yes. So I could talk about myself and how great Andrea is all day, but one of the things that we have is a little bit of a tradition where you're going to look in the camera one, and you're going to tell people who you are, what you do, and why they should care.
Okay. My name is Dr. Andrea Johnson Davis. I am a physical therapist and owner of Davis Physical Therapy and Sports Rehab. I am a physical therapist, orthopedic physical therapist, and I will work for you, with you, about you, and I care about you. And it is an exhausting job sometimes, but I love every single minute of it. If you need help with anything at all, pain, from 8 years old up to 88 years old, give us a call, please. We'd be happy to help you.
How can they reach you?
You can reach our office, 609-694-8896.
Excellent.
Thank you.
Thank you for being here.
Thank you for having me.
No problem. I'm Jim Cuccinata with Halo Health. I was here with Dr. Andrea Davis today, and we are going to go back to morning coffee after these messages.